Next up is ginkgo. This one's probably pretty familiar to most of us, either from patients asking about it or from seeing it on the shelves in stores. But before we get into the studies, let's start with the basics. What is ginkgo?
So Ginkgo biloba is this large tree and has a distinctive fan-shaped leaf with a fruit and nut, and a long history of use in traditional Chinese medicine. But I think the question I want to know about, Andrea, is why is there interest in ginkgo to enhance cognition?
Yes, so that's where we talk about this preliminary data, specifically in vitro studies. They suggest that ginkgo leaf extract might be helpful for Alzheimer's disease and that it might help reverse the decline in certain brain receptor activity that occurs with aging.
Okay, well, that backdrop, let's turn to what we see in human studies. And we're going to start with the clinical research in our healthy adult patients. And they show that taking ginkgo leaf extracts daily for about 3 months might improve some measures of cognition. That sounds a little bit familiar to what we were talking about with Bacopa. So we're seeing improvements in specific areas like immediate or delayed recall. But other research shows no significant effect on cognition in healthy adults, regardless of the dose or the formulation they used. What about any data in people with cognitive impairment, Andrea? What do we have there?
Yes. So there is a clinical study in patients with mild cognitive impairment that shows taking a specific ginkgo standardized extract for 24 months improves scores for cognitive decline and memory. However, it's important to note that these changes are compared to baseline, meaning we didn't have a comparator group to examine. And even though the changes were statistically significant, they may not have been large enough to be clinically important to patients.
Okay, well, that brings us to the part that sometimes really drives our clinical decision making when the efficacy is mixed, and that's pulling in our safety data. So, with ginkgo, it's really important to pause and ask patients, what else are you taking? What other prescriptions, supplements, over the counter medications? Because ginkgo does have many potential interactions with other substances. And I like this framework, Andrea, of thinking about 3 B's: bleeding, brain or neurotoxic effects, and blood glucose effects.
So I'll get us started with the first B for bleeding. You'll want to screen for interactions with anticoagulants and antiplatelet agents since ginkgo may increase bleeding risk. More specifically, ginkgo has been reported to increase bleeding risk in some people when taken with warfarin, possibly due to its antiplatelet effects. And even though the evidence is less direct, it's also a reasonable concern with other anticoagulants like apixaban or Eliquis, and with antiplatelet drugs like clopidogrel.
Yeah, and our next B is for brain or neurotoxic effects. That's because ginkgo seeds contain this ginkgotoxin, and large amounts of that toxin can lead to neurotoxicity and seizures. So it's important to consider that potential interaction for patients using, for example, anticonvulsant meds for seizure disorders.
And our last B is for blood sugar. In patients taking oral hypoglycemic agents, ginkgo has been associated with higher blood glucose after an oral glucose tolerance test, possibly because it increases hepatic metabolism of insulin. So it's worth being mindful of a potential interaction between ginkgo and other medications for diabetes and monitoring glucose more closely if someone wants to use it.
Yeah, so those 3 B's kind of apply to some pretty common classes of medications, Andrea. I think it's fair to say if we're considering ginkgo, let's review the med list carefully for interactions.
Exactly. And our NatMed Pro is a great place to go for that. Our interaction checker is a powerful and practical way to input a patient's medication list and supplements of interest to identify any potential concerns.
So the bottom line here, evidence for ginkgo on cognitive function is mixed. The bigger issue for many patients will be potential interactions.
So, that quick check using the 3 B's is important: bleeding risk, brain seizure concerns, and blood sugar effects. So, review that medication list before saying yes.